We thank you very much for joining us again, of course, and we do appreciate your nice reaction to our Positive Health series all this week. In just a minute, we're going to check the top stories for you of the day. But first, let's continue talking about the art of living well. We've already covered diet, exercise, and preventative care. So now we focus on good mental health. It's true that our physical well-being is very much connected to our emotional and mental health. A top psychologist is here tonight with some very important advice for us. But first, Carrie Drew continues our series on the art of living well.
About health, we don't always consider mental health. Experts say mental illnesses like anxiety, depression, schizophrenia, and panic disorders affect people of all ages, races, religions, and incomes. According to a recent report from the U.S. Substance Abuse and Mental Health Services Administration, nearly 1 in 5 American adults, almost 44 million people, had a diagnosable mental illness in 2013.
We certainly know that that number is probably even higher because we know that by the very nature of a mental illness, that it's a tendency to want to keep things inside and not share things and ask for help as much as we often should.
Clinical psychologist Dr. Chloe Carmichael says the stigma associated with mental health issues keeps people from talking openly about it.
People don't necessarily want to say, oh, I'm struggling, oh, this is all going on, and so they keep it inside, which actually sometimes makes it fester, makes things get worse.
When it comes to the common issue of anxiety, she told us some of the signs to look for.
You can't stop thinking about something, even when you try, even when you're out supposedly having fun with your friends, but that topic is still just running in the background and it's like you can't turn it off. That would be a sign that you need to maybe get some help.
Dr. Carmichael says depression is also prevalent, especially around the holidays.
People feel like they're supposed to be having this cookie cutter perfect holiday experience, and maybe they don't have family close to them, or maybe they're struggling financially.
But what if it's a friend or family member struggling? Dr. Carmichael says it's best to talk to them.
Let them know that it's okay to admit that sometimes you might need a little bit of help. If the person shuts you down, then sometimes it can actually be helpful to share with that person about your own experience. And you can tell them, if you don't want help, it's okay, but I have to tell you it hurts me to see you feeling this way.
With mental illnesses, experts say every case is different, but recovery is possible.
Having the insight and awareness and healthy behavior of seeking support when you need it is actually the best thing that you can do for yourself.